This episode of Us and Them is supported with a grant from the Claude Worthington Benedum Foundation.
Hey, it's Trey Kay. From West Virginia Public Broadcasting and PRX, you're listening to Us and Them, the show that tells stories about the things that divide us. America is on the verge of a mental health crisis brought on by the coronavirus pandemic. Even before the pandemic, 1 in 5 adults experienced mental illness each year. And now, data from the Census Bureau and multiple polls reveal a dramatic upturn in mental health concerns.
Not being able to socialize, with the people that I would on a typical basis, that's been very, very difficult. So I keep my mind distracted so I don't get back to that dark place, because there are moments when I do feel that anxiety coming back, that old feeling of that dark place again.
Recent surveys show tens of millions of Americans, anywhere from 1/3 to half of the population, say stress from the pandemic is harming their mental health. Contacts to emergency call centers and suicide hotlines are way up.
The first time that she overdosed in the parking lot of the detox. Before she went in, she thought, well, one more time before I do this. and sadly, that happens a lot.
Experts say conditions like anxiety, depression, post-traumatic stress disorder, and substance abuse are showing up on the heels of the coronavirus. It's called a shadow pandemic of mental illness, and it could last for decades.
I know from my experience, some of the mechanics and technicians that I work with are struggling as well, that you wouldn't see normally struggle. And we need to bridge that gap between physical health and mental health, because I think in this state especially, we have a lot of mental health that's going unchecked.
The United Nations reports that increased depression and anxiety around the world could bring life-threatening consequences to the most vulnerable populations. The UN urges governments to fund a more robust mental health system. It's an area of healthcare that's consistently neglected around the world and in the United States. Mental health doesn't receive the same level of investment and attention that physical ailments do. There's a lack of providers and clinics, and often insurance doesn't pay for mental health services. But with a mental health crisis upon us, how are we taking care of those who need help? There's a saying in recovery circles that the opposite of addiction is not sobriety, it's connection. Connection to a sense of purpose, to routines and community, to people who keep us on track, and who make us feel safe. But what happens when a pandemic comes along and stay-at-home orders require isolation? Social distancing helps prevent the spread of COVID-19, but it forces our life-saving connections away. And for those who struggle with mental illness and addiction, for people already challenged when the pandemic hit, the isolation can be especially crushing. And statistically, it leads to increased loneliness, anxiety, and depression.
Relapse rates here are through the roof.
That's Andrea Reed. She's talking about what's happening now in West Virginia's Wyoming County. The most recent national numbers show, even before the pandemic, West Virginia had the highest rates of overdose deaths in the country.
It's kind of like the Wild West out here right now. We had 6 in one apartment complex 3 days ago with 1 fatality.
Reed founded the Wyoming County Recovery Network. It provides counseling and support to substance abusers. She's also a student in licensed clinical health social work and plans to become an addiction mental health counselor.
It's just something that I really wanted to have more of a hands-on approach to dealing with substance abuse, as opposed to doing a lot of the red tape and the bureaucracy of it. Especially with Amanda's death, it's kind of really pushed me to go on and do more.
It's hard for Andrea to talk about Amanda's death. That's her good friend, Amanda Belcher. Amanda died in March from a drug overdose. The two women met when they would lead 12-step and relapse prevention meetings. Amanda was a recovering opioid addict and a peer counselor. Andrea says they were close.
She was beautiful inside and out. A lot of people, when they are in active addiction, people will generally just see the stigma. They don't know the person that they were or that they could have been.
Andrea says her friend was doing well with recovery and was sober for 2 years. She was a mother and was engaged to be married. Then COVID-19 hit. Andrea says Amanda struggled with social distancing and lockdowns. She was isolated from those she tried to help. At first, Amanda continued to support others through Facebook. So I'm looking at a picture of Amanda, and it's a post on Facebook. And below, it's a news article that basically says that Wyoming County law enforcement report 14 overdoses in less than 2 weeks. And then she writes, "Listen to me, guys. You all don't have to live like this!" ! Please don't feel embarrassed or ashamed. It happens, but you can change it. Be the change the world needs right now. Do what's right and get help today. We're still here for you during this COVID-19 crisis. Call me so I can take you to detox or rehab. We do recover. We are here for you. And then she puts a telephone number. I can just, the look on your face, I can tell this is tough to talk about.
No, it's okay. My friends and I that know Amanda have kind of swore that her death would not be in vain, that we would use her story like she would have wanted to help as many people as we can from it. If one person gets help, then that's worth it.
Can you describe for me what you think her final day was like?
So Amanda had actually overdosed on heroin. Billy discovered her. Billy's her fiance. From what I understand, he had to beat the bathroom door down, and he worked on her. I think the kids had told him that she was still in the bathroom, or like they heard a thud. And bless his heart, he has been really struggling with that. I'm sure with some PTSD, finding your fiance in the floor, someone that was in recovery and doing really well. And then having to do CPR on her would be horrible. I couldn't imagine.
I'm just letting that sink in. I'm sorry.
No, you're okay.
It's so upset.
This is the longest I have been not being able to cry. I mean, not crying when I'm talking to somebody else about it. Generally, I can talk to, our little circle, like people that knew her, without crying, but not too often.
It's impossible to know exactly why Amanda overdosed. But based on conversations they had, Andrea knows the circumstances of the pandemic, the mandatory stay-at-home orders, had become lethal for Amanda. She may have felt overwhelmed by the isolation from the stay-at-home orders and the social distancing. Or, Andrea says, maybe it was boredom that pushed her friend to try heroin again. it's very easy to get in Wyoming County.
For Amanda's situation, the idle time, I think it gives you too much time to think, and you don't have the ability to just go speak to someone. Do you know what I mean? Like, the social isolation portion of that in and of itself is enough, especially when you are such a social person, and she was. I don't know that she received the mental health care that she really needed, the sustained mental health care. Amanda, the biggest part for her was to stay busy, going to work every day, doing crafts. Like, she had kind of a side business where she was very crafty and did things like that. She was very open about the fact that she could not be a housewife because she needed that time away. She needed something to focus her mind on. And when the social isolation happened, I think that really affected her in a way that she was home. She started to get depressed. She wasn't fulfilling her purpose.
I'm grateful that you shared this difficult story to tell, and I'm also grateful that you're doing the work that you're doing. I'm just really grateful to have met you.
Well, thank you, and I really appreciate you kind of shining a light on the issues that people in recovery are facing.
National numbers show more and more people are relapsing from recovery during the pandemic. People are reporting more mental health concerns, and fewer than half of the people in the country are seeking treatment. That mirrors what's happening in West Virginia. Only 47% of those who are suffering are getting help. The reasons for this are complex. Many people lack access to mental health care. For some, access has to do with transportation. For others, access is difficult because there aren't enough counselors out there to help. And still many more don't have health insurance that will pay for recovery support and treatment. But there's another barrier to getting care that's very personal: stigma. It's the belief that somehow we're to blame for our own anxiety and depression, and that seeking help from a therapist is a stain on our character. For many West Virginians, getting treatment for an addiction or counseling for a mental illness just hasn't been a part of the culture. So, every day, people suffer alone and never seek help.
So kind of this mentality in West Virginia of like, when you do have problems, you just don't talk about it. You deal with it and you go on with your day. You pull yourself up by your bootstraps. So like, why would I need to go talk to somebody about it?
That's psychologist Joshua Carter. He's the director of the Substance Use Treatment Program for Cabin Creek Health Systems. Cabin Creek runs clinics throughout West Virginia where they offer mental health and addiction recovery support. Carter is a native West Virginian. He has a lot to say about stigma.
It's almost like this sense of pride. If you can deal with it on your own, it's a weakness if you need to go talk to somebody. I think it's also a little bit of like, as a culture in West Virginia, we've been kind of, I go back to the whole cultural trauma thing, we've been kind of traumatized by like outside companies, or it was the coal mining companies or the pharmaceutical companies. So we don't really trust outsiders. And it's also hard to trust sometimes even professionals, especially like with the opioid epidemic. I'll get a lot of time patients will be very uncertain of me until they realized I was raised in West Virginia. And it's like, oh, he's one of us. It's okay if I talk to him for a little bit.
Oh, that's really interesting. And so the people of the state are wary of outsiders. Mm-hmm. And that might translate into a therapeutic situation?
Yeah, it's always been fascinating to me, like as West Virginians, and we kind of did the same thing when we started talking, like almost as soon as we say hi, we ask, were you raised here? Or where are you from in West Virginia? And it's almost like this test of, can I trust you? Are you one of us?
Right. Well, it's interesting that you say that, because the name of my program is Us and Them. Yeah. And what you're talking about is an us and them dynamic.
It's the in group and the out group.
Right.
Yeah.
And that us and them dynamic, just kind of considering that, is something that might be one of the hurdles that you need to clear to establish trust in a therapeutic situation.
Yeah. Yep. Like a lot of the elderly patients I work with, like that will almost always immediately get me buy-in. Like if they know I'm from West Virginia, then we're good.
Patients who come to Cabin Creek clinics for treatment are required to have a weekly medical checkup. They also attend individual therapy, group therapy, and a 12-step meeting every week. Those frequent weekly connections are especially important in the first 90 days of recovery. When the pandemic first started, Carter was still meeting with some patients one-on-one and with people in groups. Everyone would wear masks during the therapy session. When it came time to abide with the state's lockdown measures, Carter and his staff scrambled to figure out how to continue to see patients. Carter says those in-person connections are essential right now, and that meant getting on board with telehealth.
We looked at a bunch of research, and basically what we've seen is phone appointments can be good. It's better than nothing. But video appointments is as good, is pretty close to an in-person. It's a little harder for us because as a psychologist, like I do a lot of body language myself, kind of like in therapy and then reading the patient's body language. So I don't get a whole lot of that. But then granted, with video at the moment, if we were person to person, I'd have to wear a mask and I would lose all the facial expressions that add the nuance to therapy.
Okay. So you lose the body language, but if you were face to face, you couldn't see at least a half of the face, right? The more expressive parts of it.
Yeah, I use a lot of like humor and kind of like a little bit of sarcasm in therapy at times with certain patients. And I lost a lot of that with the mask because they couldn't see the facial expression. And it came off completely the wrong way.
Carter and his staff worked through a lot of trial and error at first, getting their patients to use video chat technology.
We had a little bit of difficulty at first, just kind of figuring out on our end, like the boundaries and the rules we would set, especially like patients would try to be driving during telehealth. That first week, we treated it as like a freebie. We're going to work as much as we can. If we can't get you in because of technical difficulties, we're going to call you individually, do individual appointments while we help you troubleshoot how to get this to work.
And you say it's a freebie. Why would you be willing to extend yourself that much? I mean, what's at stake here?
Basically, people's lives and families were at stake if they fall back into that cycle of recovery. And especially there was a lot of pullback on the regulations with federal and state. We were given a lot more breathing room than we are ever given so that we could make this work.
Carter is talking about regulations on recovery drugs like Suboxone. It's a medication that keeps patients off of opioids. Carter says relaxed rules now allow him to prescribe through a video chat session. And insurance companies that initially balked at paying for telehealth therapy now approve the practice.
What would you say would be the most characteristic worry of this?
Mm-hmm.
That there's something about what we're going through in this COVID shutdown that you think is really troubling the patients you see the most?
Mm-hmm. I would think a sense of normalcy and routine, kind of that whole structure and stability, which is big in recovery in general. And a lot of the patients will talk about how they were just starting to figure out what their new normal was. And then all of a sudden they don't know what's going to be normal and if we'll ever get back to that. Because structure and stability are big in recovery. And then all of a sudden I don't have any. We've had to do a number of just group therapies on loneliness. How do I deal with the loneliness? How do I try to connect? And we'll talk about loneliness kind of like hunger. It's telling you I need socialization. But right now, you can't really go eat. You can do these Zoom calls and kind of snack.
A few days after my interview with Josh, I met up with him again on another video chat.
Sorry for the delay, guys. It's the joy of moving telehealth.
This time, he's setting up a 12-step meeting for some of his patients. He's gotten the group's approval to let me listen in. Carter fires up his account, but there's some trouble getting started. Turns out some people have the wrong link. This happens a lot. There's still a learning curve. Oh, and by the way, you're going to hear a lot of bleeps coming up. Those aren't swear words. We're bleeping out people's names. We've agreed to keep the 12-step conversations anonymous. And also the audio quality isn't great. words drop out, and there's a lot of background noise.
Yeah.
Josh?
Yeah.
I don't know if you can hear me. I'm getting a text from saying she's here, but she goes, no one else is here.
Okay. I just sent her a new link so she could check her email. I literally just sent it to her. I was looking at the emails and they sent her the wrong link. So she should have a new link and the title will say Right Zoom ID. If you can just click that link, she'll hop right in here.
Okay, I'm going to do that. Okay.
But it'll be in her email.
Yeah.
Thank you.
After about 20 minutes of sorting out how to get on the call, Dr. Carter signs off, turning the chat session over to a woman who runs the meeting.
All right. Is there anyone that wants to share? Would you like to open with? We'll open with the Serenity Prayer if everybody'd like to do that. God, grant us the serenity to accept the things we cannot change, courage to change the things we can, and wisdom to know the difference. Just for today.
There are just a few people on this video chat 12-step meeting, but the mic is only activated one person at a time. That's why you only hear one woman reciting the Serenity Prayer.
Okay, I'm an addict. I don't have a couple of you, but we haven't had any meetings for face-to-face meetings for a while. So, if there's anyone that wants to share any worries, concerns, just speak right up, okay?
Hey, my name's I'm an addict. I have like a roller coaster of emotions since the whole COVID has happened. But about 2 weeks before it even happened, I got what is medical leave from my work, and I kind of fell through the cracks. So today I've been struggling with, actually for the past couple of weeks, I've been struggling with what am I supposed to do, because I was getting a paycheck kind of just to sit around, so I made the house look good, just to be a normal person. But
looking at the video squares on my laptop screen, I can see people in different spaces. Someone calls in from their car, another from their front porch. Someone else has their camera turned off. Another keeps dropping off the call. I guess she has a spotty internet connection. 12-step meetings are meant to be a safe place where people can share their stories without judgment from others. They're about supporting one another and being accountable to each other and one's own sobriety. It's about connecting. Not surprisingly, the topics at the meeting relate to the coronavirus, the fallout from social distancing and how to make sure the stimulus checks aren't spent on drugs. They also discuss mundane aspects of recovery, like making sure they have enough Suboxone and how it makes them feel.
We have a love-hate relationship, me and old Suboxone. Basically, just because a lot of the times I feel like I don't need it until obviously you're at that moment for 2 hours where you're like, I feel terrible. I'll do anything. So then you hurry up and you take
12-step meetings are private and anonymous.
Right now,
this group initially agreed to let me listen for the first few minutes of the meeting. But once we were all on the video chat, to my surprise, they invited me to stay through the whole meeting. And they even asked me to ask them questions. One woman says she actually prefers being on the phone or in an online chat group for therapy.
With everything going on right now, I'm fine with the over the phone. I don't want to be around people.
But let's say that there was no COVID pandemic. Would you prefer meeting in person, or are you fine meeting on the phone?
I'm good on the phone. I'm not much of a people person anyway. I'm kind of a loner. I stick with my, just my immediate family, and that's pretty much it. That's just how I am.
Telehealth sessions like this 12-step meeting require a solid internet connection. In West Virginia, that's a challenge. The state has one of the lowest broadband access rates in the nation. About a third of the residents can't get online. For those who can overcome these technical hurdles, video chat seems to work pretty well.
I'm Mike Brummage. I'm a physician. I'm the medical director for Cabin Creek Health Systems in Kanawha County, West Virginia. And I'm also the program director for the West Virginia University School of Public Health's Preventive Medicine Residency Program.
A video chat with Dr. Brummage confirms a few things, namely that telehealth sessions and virtual treatment can actually be more successful for some people.
Of all the different types of telehealth that have been investigated in the past, telebehavioral health seems to be the most accepted. In some cases, actually is preferred by some people who may not, at least in initial conversations, may not want to open up as much. The space actually creates an opportunity to disclose things that they might not do in person. I was part of an Army research project that looked at asking people returning from deployment to Iraq and Afghanistan about what issues they had. And they actually found that they were more comfortable using telehealth than they were a person-to-person encounter.
Do you think that that would be, for instance, you and I are speaking right now through a Zoom conference. If this was a therapeutic session, I could at least enjoy the comfort that I'm in my home, my own environment, and that I haven't had to make my way to a place that is not familiar to me. I'm in my own comfort zone. Is that really what this is about?
Well, I think it is in many ways. And for some people, the presence of another human being when you're disclosing something that's a deep secret, there's a certain distance, that physical distance, that virtual distance, is actually a comfort. So you're right. I think it has to do with being in your own environment, but just having that distance provides a certain set of comfort too, which is counterintuitive. We would think that always being together is the best way to deal with these kinds of problems. It turns out not always to be the case. But for people who have established relationships, who are coming in for anxiety, depression, other kinds of behavioral health issues, losing that visual and spatial connection between people sometimes is very, very disruptive. So it really depends on the age of the person, what their underlying condition is, and sort of how they relate to technology to begin with.
Coming up after a break, coping with mental illness in uncertain times.
This is something that is going to go on for months and is going to greatly magnify all the inequities that we have in our society.
And we take a closer look at the mental health system in West Virginia.
Taking a crisis and learning something positive is a mantra for us here. And I think we have to consider this pandemic the same way, utilizing the opportunity to normalize talking about mental health and viewing it as something that is important and worthy of us taking the time to look after ourselves.
That's after this break. You're listening to Us and Them. This program is supported in part by the West Virginia Humanities Council and the CRC Foundation. This episode is supported with a grant from the Claude Worthington Benedum Foundation.
In difficult times, music gives us peace, brings us together, and helps heal us. It calms our nerves and brightens our days. That's why we're bringing you classic episodes of Mountain Stage on air and in our podcast. This is Larry Gross, host of Mountain Stage. Find something that's familiar or brand new and feel the power of live music on our website, mountainstage.org.
Hey, it's Trey, and this is Us and Them from West Virginia Public Broadcasting and PRX. We're talking about the mental health minefield created by the coronavirus pandemic. There's an ongoing sense of uncertainty and powerlessness we're all feeling. And for an unprecedented number of Americans, the isolation from stay-at-home orders and social distancing can lead to a range of mental illnesses. These can include anxiety and depression. They can also result in post-traumatic stress disorder and substance use. But getting treatment now isn't easy. Finding mental health care and paying for it can be huge barriers, no matter where you live in America. And some say it's even tougher in Appalachia.
We already know that West Virginia has a large number of people with depression and with anxiety issues and with other sort of behavioral health issues. And there just weren't enough of these counselors to go around to begin with. So these are going to be problems that are going to persist afterwards. And we're going to be dealing with the trauma for many people of this pandemic.
Mike Brummage is a physician, and he's the program director for the Preventive Medicine Residency at West Virginia University's School of Public Health.
The isolation, the nightmares that people are having, watching the television and hearing about all kinds of news stories, this is really going to be something that people are going to deal with for a long time.
Still, Brummage is careful to point out that many of us will ultimately work through our difficulties.
Now, granted, this is a traumatic event for everybody, but I think we have to also consider that not every obstacle in our lives causes long-term pain and adverse consequences. You know, we frequently talk about post-traumatic stress disorder as a result of exposure to trauma, but we also have to understand that there's something called post-traumatic growth, and that we can be able to talk about this and give people hope in a way that they can understand that they can grow through this. For our personal growth, we all need to be exposed to adverse circumstances, and it's dealing with those adverse circumstances successfully that helps us grow, as human beings. That's all part of our process in life. For some people who are already overloaded through poverty, through housing situations, through lack of transportation, with poor educational attainment, who are already dealing with substance use issues in their household, these things are only going to be another rock in the rucksack that drags them to the bottom. But for many people, I think we need to also give them a sense of hope that this is something that the vast majority of us are going to get through. As bad as things seem today, we're one step and one day closer to the end of this pandemic.
I've been weathering the pandemic with my mom in Charleston, West Virginia. She lives in a comfortable home, and we've got enough food and enough provisions to keep moving on. I do my work from the house, talking with people all over through video chats. But there are plenty of people, the essential workers, who face daily risks. They are doing much of the hard work to get us as a society through this. And some of them are getting sick from COVID-19 or facing extreme stress from having to interact with the public. I asked Mike Brummage to speak about the divisions that have been laid bare by the coronavirus pandemic.
Across the United States, and in Appalachia in particular, we've already had a number of inequities that are around race, for example. People of color, we're seeing that are dying and are much more afflicted by the pandemic than other people. We're seeing the people who are dealing with poverty, with adverse housing situations, who are socially isolated. And so natural crises like this pandemic, and perhaps especially this pandemic, because this is not a flood that's going to go away in a few weeks. This is something that is going to go on for months and is going to greatly magnify all the inequities that we have in our society.
So you don't mind if I have a cigarette, do you?
Oh no, you can have you can.
Okay, thank you.
Sure.
Timothy Duff says last year was one of the worst years of his life. The 33-year-old Charleston native says someone put a gun to his head in a dispute over money. One of his brothers overdosed and died. Then, last summer, Timothy planned to kill himself.
I went out of state, booked a hotel room, purchased me a new outfit, got me a good bottle of wine, put it on chill, went to a nice restaurant, had a nice dinner. And I was going to slip away, take the pills and slip away. And as I was getting ready to do that, the only thing that I could think about were my nephews. And that is what got me up and made me realize that I have more to live for, and that things happen in your life for a reason. And there was this song that had just come out maybe a few months before all of this. It was playing on my Pandora, and it was called Just for Me.
Just for me. Many doors you've closed just for me.
One of the lines in that song was, many doors you close just for me. Sometimes you will sin, so I'll be tested in your fire.
Tested in your fire to
purify my desire. So my blessings won't be just for me.
Just for me.
I was caught up in myself that I couldn't see that the world didn't revolve around me. So it really spoke to me, and it was just kind of like God said, okay, time for you to get up. I've put you through. Now you need to push your way through. So I'm glad I didn't go there, but it wasn't a pleasant place at all. Just very cold, very dark.
It's scary. I mean, it really
yes, absolutely.
Scary.
Absolutely. I'm sorry. It's still a little sensitive for me to talk about, but it's my testimony.
Yeah. Well, I'm grateful that you're willing to share it with me.
Yeah, absolutely.
All the moments I miss that were just for me, because I chose not to wait patiently.
Circumstances in his life put Timothy in that dark place. He works 2 full-time jobs. His day job is with a nonprofit. Then he sleeps a couple of hours and heads to his job at a Charleston hotel. There he works the overnight shift. He's been doing this for about 9 months because his main job was barely meeting his overhead, and he's working his way out of some debt. He was hired as the hotel's financial auditor. As the pandemic advanced, all of his coworkers, except for a couple of housekeepers, were let go. So instead of doing his desk job, his manager assigned him unrelated tasks. He vacuums, cleans bathrooms and floors, sanitizes surfaces, and checks people into the hotel. He found himself a frontline essential worker, and he didn't feel safe.
The manager at the time felt that wearing the masks was unpleasing to guests. It made it seem as though we were dirty, and so we were instructed not to wear masks. We had stopped renting to locals, so you have people coming from North Carolina, Georgia, all over the country, and having to interact with them. Even though we had a distance between us, it still was very unsafe.
Timothy has a new boss at the hotel, and now everyone wears masks. Timothy describes himself as very single. He's close to his nephews. He's often helping out his cousin, who has been diagnosed bipolar and schizophrenic. He says she's also addicted to painkillers. Timothy has diabetes and high blood pressure. He says the pandemic is spiking his anxiety.
Not being able to socialize, with the people that I would on a typical basis, that's been very, very difficult. I don't mind talking on the phone, but I would rather have face-to-face interaction, especially when I'm dealing with something. So my friends have been that safety net for me. They kind of keep me grounded, and not having that, there's been moments where it's been difficult. So I try to stay busy, so I keep my mind distracted so I don't get back to that dark place, because there are moments when I do feel that anxiety coming back, that old feeling of that dark place again.
You're talking to me about things that you do to cope, but would you like to do more? Would you like professional help, somebody who actually has more experience than just your friends and family?
Oh, absolutely. I'd love to if I had some insurance. Because there are so many issues, dealing with the depression, the stress, the family issues, the problems with the job, things that I just need to navigate, that I need someone to speak with. Just give me a very unbiased opinion and just help me organize my thoughts. because my mind just begins to go so fast at times.
Are you concerned about the pandemic and just kind of how long the state we're in is going to continue?
Oh, yeah. The world as we know it has completely changed. The fact that there has been no timestamp put on this, and we are taking a chance every single day going out there by opening up the businesses and things like that, even with no cure. That's very stressful. I worry about the mall opening up. Are things going to get worse? That's scary because I don't want life to start happening again just for us to take 15 steps back. And I don't know how I would be able to handle it because honestly, I'm tired, I am stressed out, I'm worried, and I don't want to go through this again.
Timothy clearly wants and needs support for his anxiety, but he's not getting it because he says he can't afford it. For him, mental health care is a luxury. Society seems to see it that way too. Our policies prioritize physical health over mental health. West Virginia provides more access to insurance through Medicaid expansion. However, there are many people like Timothy still falling through the cracks. One of his employers gives him money towards health insurance, but he still can't afford the premiums. And he says he can't afford coverage under the Affordable Care Act and isn't eligible for Medicaid. Even if Timothy could get insurance, policies don't always pay for mental health treatment. Still, insurance coverage is only part of the story about why mental illness goes untreated. Christina Mullins is commissioner at the Department of Mental Health and Human Resources Bureau of Behavioral Health here in West Virginia. Mullins says the state, like the rest of the country, is grappling with the scope of the problem and its solutions.
We're seeing increased anxiety and reported anxiety to our call lines like 211 and people looking for information because the more you understand, the more you're able to kind of process what's happening. What we are not seeing yet is people reaching out for new services at the level that we would expect. We're not experiencing increases in suicide yet that we're aware of. We're monitoring a lot of those key indicators very closely, but we haven't really adjusted to how we're going to meet that demand or reach those services under this new normal that people keep referring to.
National data show that the majority of American adults with mental illness do not receive treatment. That statistic holds true for West Virginia, too. I asked Commissioner Mullins why so many people in the state don't seek help for their mental illness.
It's multifaceted. There's stigma that's related to seeking treatment. People not necessarily want people to know your business or to be labeled as having a mental health condition. That's part A. But I also think part B relates a lot to access and wait times to get appointments. We have a workforce shortage here in West Virginia. We don't have nearly enough people to meet the demand.
So workforce shortage, meaning the number of providers to give that treatment. That's what you're saying.
Yes. So if you call and you want treatment and you want it now because today you're ready, but then if there's not a place for you to go without a wait, then you might not be ready when that time comes. Sometimes people put off or delay the treatment that they need.
Mental Health America, a national advocacy organization, says West Virginia has a higher rate of mental illness than many other states, and access to treatment is more difficult. Mullins says a shortage of counselors and therapists explains a substantial part of the problem.
Stigma, Appalachian culture is going to contribute to a portion of that as well, though.
But what do you mean Appalachian culture? I mean, why? What is it about Appalachian culture that I don't know.
Well,
you said stigma and Appalachian culture kind of synonymously, or it seemed to.
Stigma and access. I mean, transportation is huge. Appalachia is not an easy region to get around in because of mountainous terrain, long drive times, and those types of things, which is an access issue in and of itself. But also the tendency to be isolated and not seek help is also prevalent inside of the culture of West Virginia.
Commissioner, do you see the way that West Virginians look at mental health care as kind of an us and them type of thing? Do you see that it has the dynamic that can kind of set people up into us and them tribal camps maybe?
I think I've seen that my entire career, where it's those people as opposed to us. It's them over there, or it's a group or population focus. We never have viewed mental health the same way that we view preventive health care. I mean, women don't have an us and them about going and getting their pap test, for example. We all need that. Just as we all need a mental health tune-up once in a while, just as it should be normal that we all participate in good mental health care, whether that's in a clinical setting or it's good practices at home where we're looking after ourselves. And I don't think that we talk about those things the way that we should.
I'm wondering what you think about the idea of really trying to learn a lesson from this collectively.
Taking a crisis and learning something positive is a mantra for us here. We have to consider this pandemic the same way, utilizing the opportunity to normalize talking about mental health and viewing it as something that is important and worthy of us taking the time to look after ourselves.
Back in the 70s, when I was growing up in West Virginia, I knew people who saw a therapist, but not many. When I moved to New York City in the 1980s, everyone had a therapist. It seemed like a normal part of people's lives. And I got some therapy, and I remember how good it felt getting a regular checkup from the neck up. And I remember sharing this experience with many of my friends and family in West Virginia and recall getting strange looks. They weren't sure what to think or what to say. Therapy just didn't seem to be a part of their reality. Maybe they just thought it was a New York thing or some strange foreign ritual out of a Woody Allen movie. If you've listened to this show over the years, you know I've been upfront about how important I think mental health is. And for better or worse, I've taken listeners into a few of my therapy sessions when I was going through some tough times. We can often feel overwhelmed, stuck, powerless. And those are the times we need help. Over the past few months, we've had a lot of things come at us. The coronavirus, and now a financial crisis. It's pushing many people past their limit. Data from the end of May show that 1 in 4 Americans have applied for unemployment insurance since March. Joblessness is always bad in West Virginia, but it's worse now with very high unemployment at 15% as of late May. That's 200,000 people out of work. And studies have shown a correlation between loss of income and suicide. In April, Congress authorized nearly $500 billion in coronavirus stimulus money. About $100 billion went to hospitals and medical providers. But only a small fraction of that, $375 million, was passed on to states for mental health care. Mental health advocates say they need tens of billions of dollars more to address the shortage of providers and to help clinics that are struggling to provide care. Professional mental health treatment is one approach. Some West Virginians crave spiritual relief. Many in the Mountain State have a connection with some kind of religion, often one of the Christian variety. And maybe when it comes to problems that overwhelm people, they're in the habit of seeking relief with their church's congregation and preachers. Harlan Casto is a young guy I met recently. When we talked via video chat, his young children were playing nearby. He says when he or his family has a problem, it's usually the preacher who comes by to offer counsel.
especially in our smaller churches. Our pastors have been our therapist without knowing that, right? So we've, as a family, have experienced loss as everybody else has. And during those times, the first person that walks through the door is the pastor of the church, right? That you've went to for all your life. And they consult you, and they're there with you. They're giving support.
Harlan is a self-described follower of Jesus, but he says he recognized that sometimes he needs more. He started seeing a therapist off and on a couple of years ago and believes it has made a huge difference in his life. He wishes we could bring those two things, faith and help, together more often for people. He says people he knows seem to say, I don't know why I need a therapist. All I need is God and prayer. Harlan Casto hopes when people face challenges, they can accept help wherever it comes from. He says for some, talking with a pastor and a counselor might work well together. If you or someone you know needs help, call the National Suicide Prevention Lifeline at 800-273-TALK, 8255. The crisis text line also provides free 24/7 confidential support via text message to people in crisis when they text to 741-741. You can also find these resources at the Us and Them Facebook page or on our show page at wvpublic.org/programs/us-them. You've been listening to Us and Them. Our team for this episode is me, Trey Kay, Marisa Helms, and Kate Smith. Special thanks to Robert Hansen, Julie Blackwood, Jenny Hill, Rebecca McPhail, and Dina Thaxton Sams. Michael Lipton and Tristan Lozow wrote and performed the Us and Them show music. Mark Lerner designed our logo. Lelena Price provides us with images for the web. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the West Virginia Humanities Council, and the CRC Foundation. This episode is supported with a grant from the Claude Worthington Benedum Foundation. Us and Them was originally developed with assistance from the mentorship program at AIR, the Association of Independents in Radio. We'll see you next time on Us and Them.
Support for this podcast comes from the Corporation for Public Broadcasting.